Diabetes. Type 1 and type 2 diabetes is when your blood glucose or blood sugar is too high. Blood glucose is the type of sugar found in the blood and the main source of energy. Glucose comes from the food we eat and made in your liver and muscle. Blood carries glucose in all of your body cell as a source of energy. Pancreas is an organ located between the stomach and the spine that help with digestion and release a hormones it makes called insulin. Insulin helps your blood to all body cell. Sometimes your body does make enough insulin or the insulin does work the way it should. The glucose stay in your blood and doesn't reach the cell. Your blood glucose get too high and can cause diabetes or prediabetes. Prediabetes is when the amount of blood glucose in your blood is above normal yet not too high enough to call diabetes. Predisposed to type 2 diabetes, heart disease and stroke. You can prevent type 2 diabetes by 1. Weight loss. 2. Physical activity so you can achieve the normal level of blood glucose in the blood possibly without taking any medication. The sign and symptoms of diabetes being very thirsty. Urinating often, feeling very hungry, feeling very tired. Losing weight without trying, sore that heals slowly. Dry itchy skin, feeling of pin and needle in your feet. Losing of feeling in your feet, blurry eyesight. There are 3 types of diabetes. Type 1 diabetes, also called juvenile diabetes, develop most often in young people and also in adult. Your body no longer make insulin or enough insulin because the body's immune system, which is normally protect you from infection, has been attack or destroy the cell that makes insulin. Treatment includes taking insulin shot and sometimes taking medicine. Healthy food choices, being physically active, controlling blood pressure and cholesterol level. Type 2 diabetes, also called onset adult diabetes, can affect people in any ages. Developed most often in middle-aged and older people. People who are overweight and inactive more likely to develop type 2 diabetes. It is usually begin as insulin resistance, a condition that occur when the fat, muscle and liver cell do not use insulin to carry glucose into the body cell to use for energy. As a result, the body needs more insulin to carry the glucose to enter the cells. At first, the pancreas keeps up with the demand by making insulin. Over times, the pancreas doesn't make enough insulin when the blood sugar is increased, such as after meal. If the pancreas no longer make insulin, we need to treat type 2 diabetes. Treatment includes using diabetic drugs, making healthy food choices, being physically active, controlling if blood pressure and cholesterol level. Gestational diabetes may develop during pregnancy. Pregnant women make hormone that can lead to insulin resistance. Overweight women are likely to develop gestational diabetes. The said condition, when the baby is born back to normal unless it proceed to the development of type 2 diabetes. Babies born with gestational diabetes mother more likely to develop obesity and type 2 diabetes. Over time, diabetes can lead to more serious problem. The most serious problem is heart disease or stroke. There are 4 things you can do every day to help your blood sugar on the target range. Follow your healthy eating plan. Be physically active, take your medicine on time, monitor your blood glucose level.